Marta, thank you for taking some time to talk with me today about the turnover and how you view it. And that's actually the first question I wanted to ask you is, what are your perspectives on turnover in the healthcare industry and its impact?
Yeah, well, first of all, thank you for inviting me. I'm delighted to offer an opinion. I'm sure the colleagues in the room probably have a lot of ideas as well, so you'll hear from them. But I think, first of all, a certain amount of turnover is acceptable and should happen, and it's okay. Now, the Joint Commission speaks about 12% as being an acceptable turnover. Personally, I think that's still too high. I think some of the better hospitals, just in the healthcare industry, magnet hospitals and so on, their turnover is 8%, even 10 or even lower. So, but let's assume 12% is acceptable. Anything above that, it's problematic it's costly to the organization, costly from a morale issue, just to see the people coming in and out of the organization, costly from a training, recruitment perspective, the cost of replacing talent, even on a temporary basis. You have to hire, travelers or, nurses that come, or employees that come from other sources that usually tend to be a little more expensive over time. So it can be a very costly proposition.
And do you see it also impacting the quality of care?
I think it impacts the quality of care. In fact, even the Joint Commission and some of the researchers have actually quantified that organizations that have a high turnover see, sort of a decline in the quality as well. Again, many of the same things. You have a constant turnover. There's no stability in terms of the care of the patients as well. So I think it has an impact in that space as well.
Yeah. From your perspective, what do you think causes high turnover? Why do we face such a challenge with this?
Yeah, and I tell you, it's not just a healthcare industry problem. This is really, I've been in multiple industry, and it's sort of pervasive across. But I think it has to do with multiple factors that impact it. Personally, I think managers are probably at the front of that. The quality of the manager, are they providing the right interactions, the right feedback, all of that stuff. So I think the quality of the manager is a huge factor. I think that the methodologies that you put in place for selecting, your selection and assessment criteria in the front end. So having better tools in the front end to systematically and consistently assess candidates the same way. So when you're constantly changing that, and it's, oh gee, for me it happened, somebody has a lot of years of experience, well that makes them good. Well, not necessarily. It could be that you have 20 years of the same, 1 year of experience kind of a thing, So you really want to put the front end, you want to be really as good as it possibly can be with good assessment tools as well. So I think culturally, what kind of environment you have in the organization, employee engagement, if employees are not engaged, if they don't feel committed to the organization, they're not going to stay.
Yeah.
So, and sometimes, the economic, the environmental issues, if there are a lot of opportunities, because you happen to be in a market, particularly for hospitals and nurses, there are certain occupations, physical therapists, they just have a lot of opportunities.
Yeah. So what are you doing here at Adventist Health to try to address?
Yeah, so actually we're trying to address all of the things that I just said, putting an awful lot, and I'll talk about PEG in particular, because I think that we have since 2010 put a lot of our trust, if you will, on PEG as an instrument that has helped us. In one of our hospitals, we first started it with Shady Grove Hospital, which is our largest hospital in the system, and identified certain jobs that we wanted to kind of make sure that we were managing well, and we've seen a tremendous impact on the turnover, the reduction in the turnover for in those instances where PEG made the recommendations, and instances where we didn't listen to PEG, where things didn't turn out as well as we would have liked. So we are now actually expanding that, and we're actually using PEG now with nurses, and our expectation is that we'll use it for the entire, all the jobs in the company. So that's a significant investment for a company of our size in an organization like PEG, but 2+ years of interacting with the organization, I think, has demonstrated the value. And I also think you need to put it in the forefront or where it belongs. Turnover, people think, well, it's a recruitment issue. Well, not so fast. You know, because if you're not doing the right things, if you're not creating the right environment, you don't have the quality of the manager, and you're not selecting them, because the managers make selections decisions. HR, and I'm not trying to kind of take the heat off HR, I'll take the heat where it belongs. But if the managers, if ultimately we don't provide the right tools to make the right selections, I think we're going to ultimately make the wrong choices. And the cost is, can be significant. So I'm hoping that we will continue to see a decline, just like we saw a decline in turnover with the jobs where PEG was helping us, ASHHRA Grove. We hope to see the same thing across the organization.
Absolutely, and I know we're looking forward to working with you guys in terms of being able to measure the impact on things like quality and patient satisfaction, and because as you've said earlier, the getting the right folks in the organization and having a culture that is nurturing and allows them to stay, at the end of the day, impacts the quality of care that we can provide.
And you just made me think of something, and in fact, I think one of the areas that you said, what are you doing about it? I said, first of all, keeping it in the sort of top of mind for the leadership of the organization. And I think that happens by giving them hard data. What are the numbers? What is the cost of the turnover? What is the impact if people are not engaged? What is the impact on turnover?
Yes.
If you have high turnover, how does that impact patient experience? And I think we've been very successful, and again, this is another area where PEG has helped us in putting together very robust data points that are very compelling. So when the CEO of the company, the CFO of the company, the presidents of the various entities, when they look at it, it's not just it's a recruitment thing, it's really an impact in the bottom line. If you can make a dent on the turnover, not just in Adventist HealthCare, but any organization, you're going to save millions of dollars a year. And that resonates, especially in these time of day,
Yes.
Yeah, so it's great. Yeah.
Well, thank you so much for your time.
Thank you.
Really appreciate it.
No, it's my pleasure.